Hello, and welcome to my poster presentation here at the Healthcare Quality and Safety Conference 2021. I'd like to start by thanking the Institute for Healthcare Improvement and the BMJ for giving myself and others the opportunity to present work that's been conducted over what's been quite a turbulent year. My name's Shipman, I'm a trainee in paediatric medicine and currently studying a research master's in oncology with the University of Manchester in England. As part of the programme, I'm conducting a piece of research which forms the basis of a service evaluation at the Christie NHS Foundation Trust, also in Manchester. The service is known as an ePROM, or Electronic Patient Reported Outcome Measure, and this was launched at the Christie Hospital in 2019 as a platform called My Christie My Health. You can see a representation of this in the top left-hand corner of the poster. I'd like to tell you a little more about ePROMs. They usually take the form of a validated health questionnaire and were initially designed in the 80s to be incorporated into clinical trials as a way of re-establishing and empowering the patient voice. In cancer care particularly, they've been found to have really quite unique abilities for detecting symptomology, quality of life issues and detail of adverse drug events directly from the patient. The last decade particularly has seen a surge in ePROM use in routine clinical care in over 30 different medical and surgical specialties. My Christie My Health is an ePROM questionnaire adapted from the Common Terminology Criteria for Adverse Events, or CTCAE. Patients receive a text with an invite link 3 days before an upcoming appointment and log in using NHS credentials. The questionnaire itself encompasses multidimensional aspects of quality of life as well as symptom-specific questions such as breathlessness, pain and nausea. Based on responses submitted, patients may be sent self-help information, be directed to their GP or pharmacy, or if symptoms are severe, to contact the Christie hotline or 999. All reports are filed in the electronic patient record to be reviewed by their clinician at the next appointment. We now know that the use of ePROM services such as this provides a number of benefits at the level of the patient, the practitioner, and the healthcare organisation. I've included an overview of benefits for patients in the top right of the poster, the first being improved patient-practitioner communication. Numerous studies have shown that routine use of ePROMs increase the number of and type of symptoms discussed during consultation. They can act as an icebreaker or conversation starter. They facilitate open dialogue and discussion of sensitive issues, encourage shared decision-making, and help to prioritise or focus discussions according to what's most important to the patient. ePROM services are found to be highly acceptable to patients and practitioners alike. Obviously, there are many pros and cons when considering the use of paper or digital questionnaires, which I won't go into here, but on the whole, patients do tend to prefer to complete their questionnaires on a smartphone, a personal laptop, or often a digital device in the waiting room prior to clinic. However, ePROM results do need to be discussed and fed back to the patient in a sort of cycle, which I pictured top centre. Without actionable feedback to the patient about their results, the cycle is at risk of failing. More recently, randomised trials have shown that A&E attendance, unplanned hospital admissions and unnecessary appointments can all be avoided by using ePROMs. Several trials have also demonstrated improvements in overall perception of quality of life, and 2 recent randomised trials have demonstrated a significant overall survival when ePROMs were incorporated into routine care compared with routine care only. In line with the core NHS value of continuous improvement, my team and I are conducting an evaluation of the My Christie My Health service in order to better understand the barriers and potential facilitators to ePROM use. Completion rates in all active patient groups currently sits at 42% on average, and we'd like this to reach 75% by the end of 2022. Beginning with a review of the literature, we've designed one-to-one interviews to be held with patients and doctors, as well as patient focus groups, in order to find out what's working and what needs improving. Once we have the qualitative data, it's down to us to design appropriate interventions which will improve the service, and most importantly to make an objective measure of improvement such as completion rates. The study is at present a work in progress. Interviews with patients and clinicians are underway, but we look forward to publishing the results as we feel the outcomes will have relevance to other centres throughout the world currently utilising ePROMs. In short, we at the Christie feel that ePROMs really could be the next generation of patient monitoring. Our main group of interest are patients with cancer, but ePROMs have chameleon-like versatility and can be tailored to suit the needs of any patient group. Thank you for listening today. If anyone has questions or comments about using ePROMs as a part of routine patient care, please don't hesitate to contact me by email, which is included at the top of the poster. Thanks very much.